Welcome back, class. Shelley here. We are now on to Unit 13, which is Alzheimer's and Dementia. Part of it is from Chapter 22 in the book. Normal changes in the brain and the nervous system due to aging. Nerve cells are lost. Nerve conduction slows. Reflexes are slower. Vision, hearing, taste, smell, and touch decrease. Decreased blood flow to the brain, changes in sleep pattern, memory shortens with forgetfulness. Cognition. Certain diseases affect the brain. Cognition is the ability to think and think clearly and logically, changes in the brain affect cognitive function. Cognitive function involves focus and memory, thinking, reasoning, ability to understand, judgment, behavior, and self-awareness. Dementia is a more serious loss of mental abilities. It's a loss of cognitive function that interferes with normal functioning with routine personal, social, and occupational activities. They may lose the ability to perform activities of daily living. Dementia is a group of symptoms that often accompanies a disease or condition. Dementia is not part of the normal. It is not part of the normal aging process. Dementia can be temporary or permanent. When is it temporary? If the changes to the brain have not occurred. When the cause is removed, so are the signs and symptoms. So these are some reversible causes of dementia: a drug reaction, emotional disorders, metabolic and endocrine, somebody who's having blood sugar, kidney failure, liver failure, those kind of things, and hearing and vision loss. Nutritional loss, dehydration, tumors, infections, arteriosclerotic changes. So if those conditions are treated, dementia can be reversed. Acute confusion is called delirium. Delirium is just something that happens and then goes away. It occurs suddenly. It does not happen slowly. It's usually temporary. It's caused sometimes by an infection, an illness, injury, or drugs. It is a medical emergency. Permanent causes of dementia: Alzheimer's, vascular or multi-infarct dementia, Lewy body dementia, Parkinson's disease, AIDS, Huntington disease, excessive alcohol or drug use, and head injuries. All of these things the dementia is permanent. It cannot be reversed. The most common are the first two listed. Alzheimer's disease is the most common. Vascular dementia, which means that it's the second most common, and that is somebody who has had multiple strokes and that have caused disruption of the blood flow to the areas of the brain, causing damage to brain tissue. Signs of dementia: short-term memory loss, personality changes, problems with common tasks, and trouble finding names for familiar objects. Getting lost in familiar routes, loss of interest in the things they previously enjoyed, poor judgment, difficulty performing tasks or learning new information. Diagnosis of dementia. How it is diagnosed is first would be to establish that dementia is present. Take the history and physical and do a neurological exam. They do blood tests to rule out other things, CAT scans to rule out brain tumor, chest x-rays, cardiovascular workup to check for anything that might be reversible. And that's it.